Hello and welcome to Health Digest, a program where we dive deep into the latest developments in health and bringing you news, analysis, and expert insights to ensure your well-being. I'm Ogom Ezedimbu. On the 13th of August 2024, the African Center for Disease Control and Prevention declared MPOX a public health emergency of continental security. This significant step was taken to address the growing concerns surrounding the spread of the virus across the continent. This declaration by African CDC was followed by a global declaration from the World Health Organization on the 14th of August 2024. The WHO officially recognized the MPOX outbreak in Africa as a global health emergency. During a virtual meeting, the WHO Director General Tedros Ghebreyesus highlighted the emergence of a deadlier strain of the virus Clade 1b, which has reached 4 previously unaffected provinces in Africa, raising alarms about its potential impact. But here in Nigeria, the situation is equally concerning, with confirmed cases reaching 40 and still climbing. The urgency to combat this outbreak has never been greater. In today's episode of Health Digest, we will focus on MPOX, exploring the virus transmission symptoms and, most importantly, effective strategies to curb its spread. We'll draw lessons from our recent experience with the COVID-19 pandemic, examine the successes and challenges that can inform our approach to dealing with MPOX. And we have the Director Global Health and Infectious Disease Control Institute of Nasarawa State University, KEFI. He is an Associate Professor, Akiala Ishako. And welcome to the program.
Thank you for having me. Good evening, Nigerians, and good evening, viewers.
MPOX in Nigeria. Yeah,
this is not the first time we had MPOX in Nigeria. In 2022, we had it as being an epidemic, not more so like a pandemic, where the case fatality rate is over 40%. A lot of people died of MPOX in 2022. We saw the repeat again in 2024. To us, within the public health space, we look at this as a cyclic outbreak of an interval of 2 years. The good news about the 2024 outbreak is that there are no cases of death. So the case fatality rate still remains 0. But it has become a pandemic, calling on the WHO to declare it as a public health emergency, posing health security across the globe. It shows that as the cases tend to rise, there will be more rising cases in countries, and then there will be issues of restrictions to international travels. And then we shall be returning back to issues of quarantine, issues of having international tests before traveling or before boarding. But I will say that it is quite intriguing that as a country, we need to ask certain national questions. What have we done so far? Now that we had cases in 2022, what are we doing in 2024? What is our testing capacity rate? What is our surveillance rate? If we had these issues in 2022, we should be able to sequence the virus. We should be able to see whether we have circulating variants other than the one that has been reported over in other countries. We should also be able to see how we can develop and navigate through strategic means of interfering with the viral transmission. But those are the things that we're seeing as gaps, and those will raise a lot of national questions.
Are we seeing all of this because, according to the NCDC-DG, we don't have the strain that is wreaking havoc all over Africa yet in Nigeria? Is that why we are a bit relaxed?
Absolutely. I think that's why we're a bit relaxed. But you know that viruses changes, issues of mutations, because people travel, that's international travels. And you know that we have very, very porous borders. Even I just came back from overseas some few weeks ago. I saw how the health port authority is so porous. A lot of people tend to develop signs and symptoms of fluke, but they were not checked at the point of entry.
So you didn't feel the arrival health form?
Yeah, so you feel the arrival health form.
Did you feel?
No, I didn't. I didn't. So there are more into that. So we need to actually reject port entry health safety measures and also see to how we can be able to strengthen our surveillance system at the point of entry.
Now, you talked about the porous borders. So what additional measures should be in place to enhance surveillance?
Absolutely. So we need to also develop an active case search. My worry is that we would have learned lessons from Ebola in 2013, 2014. We would have drawn lessons from COVID between 2019, 2020, and 2021 to be able to have a sustainability plan in terms of strengthening our healthcare system. You will agree with me that we would have converted most of our testing platforms for COVID for emerging and re-emerging diseases. We would have also seen to how we would have sustained the presidential task force, would have rejigged the name, changed the nomenclature beyond COVID to say we have a presidential task force that deals with emerging and re-emerging diseases. So to me, I think that we need to strengthen our testing capacity, look at labs, private labs, public labs that were into testing of COVID, and see how we can optimize those labs to test for MPOX. We should be able to see how we reject our active case search to be able to see how from the local primary health care where people present themselves with signs and symptoms associated with MPOX, how are we going to manage those cases? Cases of isolation, cases of how we can be able to report data from the subnational to national. So I've been within the public health space, and I've also consulted for WHO and NCDC, and I can tell you that more has been done within that space for reporting of cases, but we need to do more in terms of building capacity, how we should be able to transmit cases from subnational level down. But the question is, what is Nigeria doing about the vaccine production? It is a question that is beckoning answers. 3 weeks ago, Ghana was given the license to produce cholera vaccines. You know that between 1950 to 1960, Pawosu was given the license. Nigeria was given the license to produce yellow fever vaccines. We are supplying vaccines to West African countries. And then in 1991, we lost that. A country of 250 million people with an explorative birth rate, where we still battle with issues of diphtheria that are childhood diseases, cannot be able to produce vaccines. So my take is that we can have a conversation around that. I thought maybe with COVID exposing the vulnerability of our healthcare system, would have think in the direction of having a vaccine production.
That was actually in the conference before.
Absolutely.
The 10 billion naira that was donated for that purpose.
But it will not work. Just like the way we are battling with how refineries will work, and then we had the Dangote refinery. I think the way to go is to bring out the private sector investment into vaccine development. Or perhaps, if I'm President Tinubu, which I hope to be a president one day, I will look in the direction of setting up a presidential vaccine initiative to see how Nigeria, being the giant of Africa, should be able to produce vaccines and be able to service African countries. If countries like Senegal, if countries like Egypt, South Africa, Tunis, and Morocco will be able to produce vaccines, what stops the giant of Africa from producing vaccines?
But if you remember very well that during the Ebola outbreak, we didn't have any vaccine to fight it, but we fought Ebola. So why are we waiting for WHO, for African CDC to send in vaccine for us to fight MPOX that is already endemic in the country?
Absolutely. When Ebola came, Ebola is more infectious than monkeypox. The hospitalization rate, the case fatality rate, the transmission dynamics of Ebola are totally different from that of MPOX. You will agree with me that you and I, maybe I don't know whether you woke up midnight to take salt water.
No, I did not do that.
Or you bite it with salt water.
I didn't do that.
You didn't do that, okay.
Not at all.
Yeah. So you find out that we actually have stringent measures at our ports. The port health surveillance were quite mounted at the port health. And then people coming in actually filled in forms. People were quarantined. So you look at the infectivity rate of MPOX and Ebola, they totally differs. But with advancement in medical sciences, it is quite key that vaccines produced against infectious diseases are quite helpful when it comes to combating emerging and re-emerging diseases. This is because they tend to protect the well-being of a larger population and give them what we call herd immunity. So I think the way to go is that if WHO has given us vaccines, I think we can actually do some trials with the vaccines. Let me share something with you that we have not done, as 21st century is a knowledge-based economy. When we had COVID vaccine, nobody established a baseline, whether the vaccine was efficacious. We only took a jab. Nobody collected our blood as a baseline. After we took the vaccines, to check whether our body actually elicits immunity towards that. But my call this evening is that we should actually have a national task force, not only for MPOX, not only for COVID, but for emerging and re-emerging diseases. And we should have a technical working group, a presidential one to be inaugurated, that it should be tenure-based and should be sustained. If we, after COVID, we disbanded the presidential task force. We never knew that there would be another pandemic to come, because just like the way we encroached into the environment, and then there is also an interface with animal population with the environment, viruses also changes, microbial cells also changes. So in time to come, we'll be faced with pandemic. We thought maybe COVID was the only pandemic, but you see that in less than 2-3 years, we had another pandemic, which is MPOX. Who knows what will be the next pandemic? So I will be calling on federal government, federal Ministry of Health, to think in the direction of establishing actually a technical working group and a presidential task force to look at emerging and re-emerging diseases, where we can marshal strategic plan, national plans to contain future pandemics to come.
Now, you talked about all the happenings during the Ebola, how the port health was well equipped to do their job. But I believe that, or I think that the Ministry of Health, the NCDC, the National Primary Healthcare Development Agency are supposed to work together.
Absolutely.
But what I'm seeing recently is like they're all working in silos.
Yeah, absolutely. So actually, I agree with you on that premises. To have a formidable health force that should be able to combat most of these imaginary emerging diseases, we need to work as in synergy. If you ask NCDC to give you data for cholera in this country, they will ask you to go to the WHO. They will ask you to go to MSF. MSF will give you a different data. WHO may give you a different data. NCDC, that's supposed to be a custodian of those data, will give you different data. In 21st century, we use data for planning.
Sure.
So we need to work in synergy. The mandate of NCDC, National Primary Healthcare, and Federal Ministry of Health, which is the parent ministry, supposed to be like an umbrella to house most of these agencies to work in synergy. And that is why the same thing we have in security, because most of the security agencies are not working in synergy in terms of data sharing. And that's why you have proliferations of insecurities all over. The same thing with health. People work in silos. People have different data. People are being territorial in guiding their data. And that's why we need to have a centralized pool of data cloud where we should have conversations, and people need to work in synergy. I'm quite happy with the president bringing a whole lot about the Ministry of Health. You see, he said he's a coordinating minister of health and social welfare. So there are what are called social determinants of health, which speaks to about the social indices, because those are the drivers, are predictors of if you want a Kerala to have a poor health-seeking behavior, deprive him of some social needs, and then you find out that there are... So I like the dynamics, but that the agencies around those ministries need to work in synergy. Let me share something with you. Nigeria at this point don't have a debt register. We don't have a debt registry. We struggle with birth registry. If a woman gives birth in Inewi, how is it captured 247 real time in the national dashboard? We tend to have those issues of not having platforms to be able to harness those data. If someone dies in Kauranabuda, how do we know the cost of that? Is it as a result of A, B, C that we can't be able to mitigate? And so we need to have a national discourse on that and begin to see how we can push forward.
Now, you recommended the National Task Force for Emerging and Re-Emerging Diseases.
Absolutely.
So what other recommendations can you give to us as a country?
I think that we need, beyond having a national task force, we need to strengthen our subnationals. I think we have been overburdening NCDC, that virtually all samples has to be transferred, transported, even infectious materials from local level to the state level and then down to the national level. What stops us from having to decentralize the mandate of NCDC to state level? Just like the way we did for HIV and AIDS. You find out that NACA is present in every state as SACA, State Action Committee on AIDS. What stops us? I'm from Nasarawa State. What stops us from not having Nasarawa State Center for Disease Control? And then we should have, now that we have autonomy for local government, what stops us from strengthening, the local government public health department, so that we don't need to transport samples taking 2, 3, 4 days, arriving to national reference lab to be diagnosed, and then feedback. So it takes a whole lot of time. You cannot be able to pin down the transmission dynamics. So one, I would recommend that NCDC should be decentralized. 3, I think that time has come for us to have social security safety nets for our people. If I asked you now, what is the financial security safety net for you, you will tell me it is BVM. It is a number that is specific for you, and then it is linked to your financial profile. We don't have any number that speaks to the health profile of Nigerians. So what stops us from having a specialized number beyond the health insurance scheme number to have a social security safety number that will accommodate Nigeria under an umbrella? In this 21st century, we are sharing palliative. You have to keep money. People need to snap the money in Naira at the 21st century, where if you have a social safety security number that is linked to a particular account, you should be able to transfer this money for accountability. My aged mom, who is 82 years old, got fertilizer during additional through a fertilizer wallet. I know you need to optimize digital health platforms for people to have that kind of conversation. And lastly, I think we are looking for state police. We now have the Civil Defense Corps. My take as an individual is that we need to have health corps marshals that are locals. We have proliferations of colleges of health, people graduating as community health extension workers. What stops us from integrating them to have health corps marshals, where they become disease detectives at the locals, be able to see disease, identify disease, begin to do case finding, begin to do contact tracing, begin to build their capacity to transmit results, to collect samples, because these diseases are the locals, and we need local solutions to handle our local problems.
Now, before I let you go, I'll need you to talk to Nigerians concerning about MPOX and what they should do to stay clean. And now that we have a vaccine in the country already, we talk to them about the importance of vaccine as well.
Absolutely. So you discover that most of these infectious diseases, the preventive measure is one, non-pharmaceutical. MPOX can be contacted via contact with an infectious fluid that can be released from an infected individual to aerosols. And so the use of face masks is quite key
We are going back there again.
Yeah, we need to go back to face masks. Japan did not come down with COVID because 30, 40 years ago, face masks has become their culture. I did some of my postgraduate training in Japan. It's a culture. It's all seasons, both fluke and non-fluke seasons. People tend to wear face masks. I encourage my aged mom to use face masks. There was a wave of COVID last 3 months. We found out that people were coming down with flukes, and we could not also understand that it was a wave of COVID. I took certain samples of some people, aged people, and I discovered that they were positive. We left COVID non-pharmaceutical measures, and the issues of washing of hands. The issues is that, do we really have the water to actually wash our hands? Are the water potable? So that brings to the national questions, do we have water that is potable? If we have water that is potable, issues of water-related diseases like cholera wouldn't have been an issue. That we had issues of cholera that has become endemic and cyclic and sporadic over seasons throughout the year. So I will call on the Nigerian government to actually see to how we should be able to provide potable drinking water. We should also avoid overcrowding, tend to isolate ourselves. If it is not too important, gatherings that where people will meet in mass should be avoided, and we should avoid interface with animals and animals' products. We should also see to how we should properly cook our food, and then see to how food hygiene should be on the front burner. But there will be no end to an advocacy. So what we are doing now, the platform that you have created on Health Digest, I hope that it should be sustained, and I hope that public enlightenment through public health advocacy should be sustained for virtually all the infectious diseases and all the non-pharmaceutical measures.
Thank you so much. Associate Professor Akpele Shaku. He is a Director, Global Health and Infectious Disease Control Institute of the Nasarawa State University, Kefi. Thank you so much for your contributions.
Thank you so much for the platform. I remain indebted. Thank you.
Thank you. The program is still Health Digest. We'll take a break now to bring you health news. Stay tuned.
On Health News today, resident doctors in various states are currently observing 1 week-long strike to demand the release of their colleague, Dr. Obola Ganiyat, who has been in captivity for over 8 months. Hospitals visited showed that only consultants, medical officers, and other health workers are carrying out healthcare delivery services. The decision by resident doctors to embark on a warning strike was taken during an emergency National Executive Council meeting on Sunday night. Dr. Ganiyat Bobola, until her abduction, 27th of December 2023, alongside her nephew, worked at the National High Centers in Kaduna. The decision by NARD to embark on the strike has raised concerns in the wake of ongoing health challenges, including the spread of MPOX and other infectious diseases and rising case of non-communicable diseases. NARD has called on the government and security agencies to intensify efforts to secure Dr. Bobola's release and ensure the safety of the healthcare workers nationwide. The association has also warned that if no concrete action is taken after the warning strike, they may escalate their industrial action, which could further cripple healthcare services in Nigeria. To combat the growing threat of non-communicable diseases in the country, the federal government has launched 4 key policy documents aimed at preventing, controlling, and responding to NCDs nationwide. At the launch, the Minister of Health, Professor Ali Patti, represented by the Permanent Secretary of the Ministry, assured that the Ministry will prioritize the effective implementation of these policies, ensuring tangible improvements in the health and well-being of all Nigerians.
It is encouraging to note that the majority of non-communicable disease risk factors are preventable. The launch of these publications is a crucial step in our nation's journey towards a healthier future. These documents are not just guidelines, they are instruments of change that will shape our healthcare practices and policies for years to come. Globally, countries that have implemented comprehensive NCD strategies have seen remarkable improvements in the public health outcomes.
Overall, we are committed as Resolve, and also with everybody here, particularly our government. So we hope that these partnerships and collaboration will help us to implement high-impact NCD interventions in a way that we will be able to forge that formidable force or coalition to make the difference.
Walter Mulombo, the World Health Organization country representative, highlighted that NCDs are now the leading causes of death globally, disproportionately affecting low and middle income countries like Nigeria.
WHO will be expanding its support that we have started in FCT to an additional 4 states of your choice. And we will drive very aggressive and effective NCD prevention and control program in those states, just to show the example of what it will be in other states.
Part of the strategies put by the current administration is to ensure that we correct all those anomalies, especially the inverse care law, which inequity in the care of people with either communicable or non-communicable disease.
Other stakeholders in attendance expressed confidence that these policies will strengthen Nigeria's national health system, enabling the delivery of efficient, effective and affordable healthcare services that improve health outcomes through NCDs prevention and management at all levels. The documents include the National Policy for the Prevention and Control of NCDs, the National and Task Shifting and Task Sharing Policy, and the National Guideline for the Prevention and Management of Hypertension. Osun State Government says it has recorded 1 new confirmed case of MPOX in Ilesha local government area of the state. The state government declared this during a press conference held at the State Secretariat in Osogbo on Monday. The new confirmed case of MPOX on a 25-year-old male will be the second case from Ilesha West local government this year, as 1 case has been recorded there in March. The 2 cases have triggered the state government to activate Incident Management System, a coordinated effort involving multiple agencies to control the outbreak.
Don't entertain any fear whatsoever. COVID-19 came, combated it successfully. Cholera wanted to come, we prevented it from coming. Now that we have this confirmed case, we have to meet and put this together.
The team says it will ensure contact tracing and engage in public enlightenment on the preventive measures against new variants of MPOX. The Osun State government said out of 47 suspected cases of MPOX, only 2 cases were confirmed, while the other 45 tested negative.
And that's our package for today. Thank you so much for being a part of it. I am Ogom Izedimbo. Do stay safe.